So while I was editing this video, I thought I may need to add a caveat to this video. Um, so there's a few things I want you to consider before watching this video. One, everybody's contract is different, meaning every provider has a different contract with the insurance companies. Every facility has a different contract with the insurance companies. Every specialty has a different contract with the insurance companies. So we have to keep that in mind when we're doing denials and also when we're coding because all contracts are not the same. It's based on the physicians or the provider's specialty, it's based on their level of expertise and a whole host of other things. So keep that in mind. The way that I work my denials for my providers may be different from the way that you work your denials for your department or your providers. Number two, when you are working denials, coding guidelines trumps everything. If the coding guidelines is not applicable to your denial, then you have to rely on your payer policies and your company provider facility policies. So there's three pieces of information that you have to keep in mind when you're working your denials or when you're coding. Coding guidelines, payer policies, and company policies. So again, my company policies may be different from your company policies. All of our coding guidelines are the same, but all of our payer policies may be different. Payer policies is dependent upon by region, state even. So you need to consult all three of those pieces of information when you're doing your denials. So with that said, let's work some denials. What's up, everyone? My name is Kat, and I am a certified professional medical coder, certified professional medical auditor, medical biller, and owner of Superior Medical Consulting, where we supply superior billing solutions for your private practice. You can visit our website at superiormedicalconsulting.com to schedule your free consultation today. And this is Level Up Medical Coding. So they have been sending me a ton of emails because I'm a little bit behind in my denials right now, but it's only because of month end last month. Month end was crazy. I took some time off in November, and so that kind of, pushed me behind because I have a backup, but not really. And I lost a couple days of, work. I have a whole little schedule in my head how I work my denials at the end of the week, and I took off a few Fridays in a row, so I'm behind in my denials. This first denial is one date of service, and it's telling me that we built out a 99205 with a GT modifier, and it says the service is not payable for this contract. This particular insurance is Blue Cross Blue Shield, and since this visit was telehealth, they don't pay telehealth level 5s. Our company policy is to only submit payments up to a level 4. And so what I am going to do, I'm going to go ahead and correct the CPT and then just go ahead and submit a corrected claim. And it's just as easy as that. So I went ahead and updated it to a level 4 and got that out the way. So this next denial is one date of service. It says these services are not covered within the global period of another service. And it's showing that we charge an inpatient stay, inpatient E&M. So I am going to have to add a modifier to this one because I'm sure the visit that this patient had is not pertaining to the surgery that is bumping up against. So let's take a look. The patient had a surgery in cardiology, and we are charging, they came back for a behavioral health visit, these two charges are bumping up against each other. Now, the cardiology surgery or procedure has nothing to do with the behavioral health procedure or the behavioral health visit that the patient had. They had this cardiology visit on the 26th, and the date of service for their behavioral health visit was on the 27th and 28th, because they were still in the hospital. But they're saying that I need to put in a modifier to show that this visit was unrelated to that. So if you know, I don't have to deal with modifiers in behavioral health that often. I need a modifier that shows that it's an unrelated procedure or service and it is by a different provider. Thinking I have to research that one a little more, because let's just go to the next one. So this next one is saying that per the fee schedule, this is not a new patient, is not covered. So what I'll have to do is I've been coming across this denial with this payer, and so I have gotten permission to go ahead and correct this to an established patient because they don't pay for new patient visits. So this next denial is the same thing. Charged a new patient, and this payer doesn't pay for new patient behavioral health visits. So you have to go ahead and update the CPT code. So this next one is the same freaking denial. So obviously I'm not remembering that this insurance doesn't pay for new patient visits, which is crazy to me. Oh no, this was a level 5. Not only do I have to correct the level, I have to correct the patient status. Well, change it from a new patient to an established patient, and also bring it down from a level 5 to a level 4, which is disheartening to me, but it is what it is. All right, so this next one is I build out an add-on code without a parental code. So let's see. So I built out a 96133, and it should be 96132. So when we work our denials, our billers will create a spreadsheet for us, and they basically give us the date of service, the date that they sent us, the date they added it to the spreadsheet, the department the denial is for, the billing provider, the charge amount, the CPT code that we billed, the denial reason that they found out, if they had to call in or research anything else for us. They have a section for that, for their comments. They let us know when timely filing would be, and they let us know if it was an electronic submission or a paper submission. And then they want us to update the spreadsheet with our name, what we did, and send it back to them and let them know that it's ready. So this next one, it says there's no modifier on this claim and it denied. So especially in behavioral health, there is an education modifier that needs to be, or a licensure modifier that needs to be added to all the claims for some insurances for behavioral health. And sometimes if I'm working too fast, I'll forget to put that on there. So I have a list, like a little cheat sheet that I made for myself, so that once I know it's the insurance that uses that modifier, then I will just basically go on that spreadsheet, on my little cheat sheet, look up the provider's name, and then add the correct modifier. So some of the modifiers that we use for this type of situation would be the AF modifier, the HP modifier, the HO modifier, and the SA modifier. If you want to go ahead and look those modifiers up to see what that entails or what they mean, be my guest. Yeah, that's something that is only required on select insurances, usually Medicaid. From my experience, send out a corrected claim. So I guess I didn't have really as many denials as I thought, because I'm almost done.
Okay, so this next one says that the bill type is inconsistent with the place of service. So the CPT that was billed out is probably an inpatient CPT, and I probably billed it under outpatient place of service, but I'm gonna go ahead and just check and let's see. Yeah, I don't know, because this actually looks correct. Yeah, that one actually looks correct. So I'm either going to have them to appeal the denial or escalate this to management so that they can take a look at it and let me know what they think. But it looks correct to me. The place of service is definitely correct with the charge that we billed out. So I don't know. So this next one is saying that this was a telehealth visit, but the modifier was not added. So let's just go ahead and verify that and go ahead and add the modifier if we need to. So this states that it was an audio only, and I added a modifier 93 for the audio only. So I need to go ahead and look up Blue Cross and Blue Shield's telehealth policy. I need to know if they utilize modifier 93 or not. And also, do they accept audio only visits? So I found out that Blue Cross Blue Shield does offer audio only for behavioral health services. They said this is not a change. They've always done that. They created an amendment that was effective on September 1st, 2021. And it doesn't tell us that we have to use any special telehealth modifier to differentiate audio only services. So I'm gonna go ahead and just update that and change it from the 93 to 95. This is the standard telehealth modifier, either 95 or GT. And then just go ahead and send a corrected claim, my bad, and get it out. All right, so I got another one that says that the modifier is wrong and it's Blue Cross Blue Shield, so it's probably the same thing. Probably added a 93 modifier instead of a 95. And now I have to make another cheat sheet that says, out of all the insurances, Blue Cross is the only one that, if it's audio only, still wants the 95 modifier. All the other ones that we bill for request a 93 modifier. All right, I got 2 more left for this department, and it looks like missing the education modifier for these 2. They both is the exact same patient, different dates of service. All right, so all the ones that I can do has been done. I have 2 that I need to work a little bit harder on. So I'll go ahead and work on those when I get a chance to go in the office or call a manager or something like that. Work with the biller. I don't know. We'll see. I'm going to go ahead and answer these emails. All right, so I am going to move on to urology. So urology is set up the same way, the urology biller. Basically, just fill out the spreadsheet, the same information. Let us know why it was denied and ask us to review it to see if we can make any coding changes. Urology is a little bit more difficult than behavioral health, because usually behavioral health, it's just that maybe I didn't add the education modifier or the place of service. The way our system drops some of the stuff, if the note type was like initially, say, telehealth, and the provider decided to go see the patient in person, then it turns from a telehealth visit to an in-person visit. So the system doesn't pick that up, that the note type is updated. And I don't necessarily check the POS because that's something on the back end. But when I get the rejection, then I'll have to go in and update the POS, on my end, because I just assume that it's right. And usually it's right. Usually I don't have to change that, but there are a few that does that. So I'll just go up, and it's no big deal. It's just a rejection. Not saying that it's like not important, but we want the claim as clean as possible when it goes out the first time. So, but this does give me an opportunity to correct it and get it out the door. So my first denial I see here, it says that we built out a service that had a 10-day global period. They came back for maybe a follow-up or a revision. It looks like another unplanned surgery. And so either I need to see if these charges were related to the surgery that they had prior, less than 10 days ago, or if this was a new surgery, or if it was like something that was planned and unrelated. I just need to go ahead and research why the patient came back in so soon, and then see if there is a modifier that would fit that encounter description or encounter story, or if I need to just accept the denial. Sometimes we do have to accept denials. Like, the providers usually just bill out what they've done. They don't necessarily say like, oh, we know we saw this patient and this is in the global period. They don't some of them do, but some of them don't. They don't necessarily say that. They don't necessarily realize that. So what I do is I have to go in and research, when did the surgery happen or the procedure happen? When did my charge occur, and how can I, get both of them to pay if possible? And if I can't get both of them to pay, then which charge should we not bill for, and we just have to write off, or what, or if we have a policy, an internal policy, what policy we have to follow. So this one looks like it's going to take a little bit of time to research, because it looks like this patient had a complication and had to come back. Okay, so it looks like I see what happened here. It looks like whoever entered these charges just entered them wrong. But I want to take a look at that a little bit deeper, so I'm just going to skip that one for now. So this next one was pretty much the same thing. Patient came in. Patient had a major procedure done. It had a 90-day global period. Patient came back in, and we are trying to figure out if this was an unrelated visit that they came back in for, or was this part of the post-op. And if so, then I would need to go ahead and accept that denial, because we all know that if it has a 90-day global, anything related to that procedure 90 days after, up until 90 days after, is covered under that one procedure. So I'm going to go ahead and change that to a follow-up post-op visit, and then just add a DX code to show that this was a post-op diagnosis. So that's an instance where, like I said, we'll just have to kind of accept that denial. It wasn't supposed to be billed out anyway. This next one says that we billed out a new patient CPT, but this patient was seen in the urology before. And so they just kind of wanted to see if I can bill out an established patient instead. So we are going to just verify that. And once we verify it, we'll go ahead and update the CPT code. And yep, that is true. We did see this patient before. We saw the patient in the inpatient side. So it didn't show up on the outpatient side it didn't show up in the outpatient side that the patient was established. So I just have to go in and update the CPT. So this is another Blue Cross Blue Shield patient that was seen via telehealth, and I billed out a 93 modifier, which I now know a 95 modifier is what they like. So I have to go in and just update that modifier, and then just send out a corrected claim. So on this next one, it's telling me that I have two CPTs that is bundling within each other, and because I am still really new to code urology, I haven't got into my memory what's bundled and what's not bundled. I do use an encoder when I build to try to like minimize some of those bundling denials, but I don't know, it's not 100%, of course. So I am going to just pull it up and just see what I come up with. And I'm sure I'm probably going to have to agree with the denial just because I already have modifiers on it because I knew that it was, you know, 2 procedures done that was probably kind of related. So I built out 54512 and 54640. And when I run it through encoder, it's telling me that it's cool as long as I have a 51 modifier on my 54640. So what I'm gonna do is just tell them that they probably will have to see if they can appeal it because my encoder is telling me that it's fine. But if the appeal is not successful, then we can just go ahead and accept the denial because we won't really have a choice then unless somebody wanna, you know, really wanna fight it. This denial is the exact same thing, the exact same codes. It's telling me same insurance. So it could just be something with that insurance that I'm not aware of at the moment, but once I work with it a little bit more, it'll probably become apparent to me. But for now, I'm just going to act as if I know I'm right and they just need to figure it out. Yeah, no, that one is the same thing. So I'm just going to tell them that they probably would need to appeal. I don't have any bundling edits that I can verify and see if they can go ahead and appeal. And then I'll just go ahead and follow up on that and see what they say. All right, so this one is showing there is an exclude. So I just was working too fast. Let's see what date this is. Yeah, I just was working too fast and didn't remove all my excludes diagnosis because I usually try to get them all out the way because I know doctors to add everything on there and some of these diagnoses are encompassing of one another. So I try to take them off. So in a case like this, if you submit something that has excludes note in the code book and you build it out and it gets denied, all you have to do is remove the diagnosis code that is excluded and just submit a corrected claim. All right, so this next one is stating that they need notes. So I have to wait till I get into the office to print out the notes, highlight the stuff, and get it sent over. So I can't do that one right now. But this next one states, this patient was seen in the ED. The provider submitted a office visit, E&M. And so I need to update that E&M to an ED E&M. So I just need to verify that this procedure or this patient was seen in the emergency department, which the note type is, and place of service is 23, which is the emergency department, and corrected that to an emergency department E&M. And I think that's all good. Let me make sure this modifier is still good. Yeah. So this was an evaluation and management service in the emergency department that resulted in an emergency surgery. So we had to change the E&M from a new patient level 5 to an emergency department level 5. Also append the modifier 57 to that charge. And then also make sure that we add the charges for the surgery on the same encounter because it happened. They sent the patient straight over to the OR to have a procedure done. So I corrected that and went ahead and let the biller know that I updated the CPT code. All right, down to my last two. Another bundling issue, denial. So let's see what's bundling. This biller did not give me a lot of information. So I need to open the claim. All right, so we just need to add a modifier to this because There was two office visit and a procedure done on the same day, and the office visit did not have a modifier on it. So just go ahead and add the modifier. And the last one is a global denial. Is saying that the services for this date of service cannot be billed because it is during a global period. So let me just verify that this visit was related. And if it was, I'll go ahead and change it to a post-op visit. But if it wasn't related, then I'll have to go ahead and add a modifier that shows that this visit was unrelated to whatever is bumping up against. So this visit was done on 11/9. I think we just need a modifier on here. It looks like it's bumping up against an ultrasound. I don't understand why this is bumping up against something, but I'm gonna ask them what other service that this was within a global period, unless they was at another facility and something happened at that facility. Yeah, unless they was at another facility. All right, so we're all done with denials. That was pretty fast. I've been recording for about an hour. So it took me about an hour to get through 2 departments of denials. I haven't done denials since November 30th. Today is December 7th, so about a week. And it only took an hour out my day to do denials. That was from about a week. I have a few of them that I have to wait till I get into the office to do because I either have questions that I need to get a supervisor involved, or a biller just to explain to me what's going on, and one that needs the medical records, and I'm not printing them out at home, so I need to get to the office so I can print that out, highlight it, and then, get it over to the biller so they can go ahead and appeal this claim. But that's it. If you have any questions or any concerns or anything like that, the comments. If you like videos like this, I can do another one, and I do my denials sometime in the future. But if this video wasn't helpful, I won't do another one, just because, I guess if you guys aren't interested, I don't need to do it. But I just want to thank you for watching today, and I hope that you have a great day, and hopefully this gave you a little insight, day of a life of a medical coder. Talk to you soon.